Question 1. A senior medical radiation technologist has consistently demonstrated exceptional leadership by mentoring junior staff and has published research that significantly improved patient care protocols at a national level. Their department manager believes these achievements warrant formal acknowledgement from the profession's national body. To which CAMRT initiative should the manager submit a nomination to honor this technologist's outstanding contributions? A. The CAMRT Annual General Meeting Agenda. B. The CAMRT Professional Conduct Committee. C. The CAMRT Awards and Recognition Program. D. The CAMRT Continuing Professional Development Portfolio. Answer: C. The CAMRT Awards and Recognition Program. This question is about understanding how the CAMRT celebrates excellence among its members. The keywords honor and outstanding contributions signal that the goal is to celebrate achievement, not to handle a complaint or track education. The CAMRT Awards and Recognition Program is the formal pathway through which the association acknowledges members who have made significant contributions to the profession in areas like leadership, research, and education. For example, a technologist could be nominated for a specific award for their groundbreaking work in patient safety. Here's a helpful way to think about it. While other parts of the CAMRT focus on rules and requirements, the awards program is all about celebrating the very best in the field. Question 2. A patient expresses concern about the privacy of their diagnostic images and personal information. Which core principle within the CAMRT Code of Ethics most directly governs how a technologist must handle this type of sensitive data? A. Responsibility and accountability. B. Patient-centered care. C. Confidentiality. D. Professional integrity. Answer: C. Confidentiality. This scenario tests your knowledge of the ethical duties outlined in the CAMRT Code of Ethics, specifically regarding patient information. The principle of confidentiality directly requires technologists to protect a patient's private health information from unauthorized access or sharing. While accountability and integrity are related, confidentiality is the specific rule about keeping patient secrets safe. For instance, a technologist must not discuss a patient's case with friends or family or leave their records visible to the public. To keep it simple, just think of confidentiality as the doctor-patient secret rule for MRTs. Question 3. An MRT has been practicing for 10 years and has maintained their CAMRT certification by consistently meeting all requirements. As part of the annual renewal process, the technologist is required to submit a portfolio documenting activities such as attending workshops, completing online courses, and reading professional journals. From the perspective of the CAMRT's mandate to uphold professional standards, what is the principal objective for requiring certified members to engage in and report on these continuing professional development (CPD) activities? A. To provide a basis for calculating annual membership fee increases. B. To ensure members maintain and enhance their competence throughout their careers, adapting to new technologies and practices. C. To create a national ranking system of MRTs based on accumulated credit hours. D. To gather data on the most popular educational events for marketing purposes. Answer: B. To ensure members maintain and enhance their competence throughout their careers, adapting to new technologies and practices. This question tests the purpose of continuing professional development, CPD, and the keywords principal objective point to the main reason the CAMRT requires it, which is to ensure members maintain and enhance their competence throughout their careers by adapting to new technologies and practices. The medical field is always evolving, so CPD ensures that technologists stay current with the latest knowledge and skills to provide the best and safest patient care. For instance, a technologist might attend a webinar on a new imaging technique to improve their daily work. This requirement isn't about creating rankings or setting fees. Its core focus is on maintaining high standards by promoting lifelong learning. Here's a helpful way to think about it. CPD means your learning journey never stops, ensuring you're always at the top of your professional game. Question 4. A technologist is reviewing the CAMRT website for resources to improve departmental procedures for patient safety. Which specific type of CAMRT documents would provide detailed, evidence-based recommendations on how to perform specific procedures or manage clinical situations? A. Annual financial reports. B. Best practice guidelines, BPGs. C. Conference agendas. D. Membership application forms. Answer: B. Best practice guidelines, BPGs. This question tests your awareness of the practical resources CAMRT provides, with the clue being evidence-based recommendations for procedures. The Best Practice Guidelines, BPGs, are comprehensive documents created by the CAMRT to guide technologists on the safest and most effective ways to do their job. These are not just general ideas, but detailed instructions based on scientific evidence and expert consensus. For example, there is a BPG specifically for performing pediatric imaging to ensure children receive the lowest possible radiation dose. Think of BPGs as the official, expert-written how-to manuals for the MRT profession. Question 5. A student in a medical radiation technology program is learning about the different specialties. Which of the following lists accurately represents the 4 main disciplines for which the CAMRT provides certification and professional advocacy? A. Radiological technology, sonography, cardiology, and dosimetry. B. Nuclear medicine, radiation therapy, magnetic resonance, and radiological technology. C. Respiratory therapy, medical laboratory science, kinesiology, and magnetic resonance. D. Radiation therapy, dosimetry, nuclear medicine, and sonography. Answer: B. Nuclear medicine, radiation therapy, magnetic resonance, and radiological technology. This question asks you to identify the specific group of professions represented by the CAMRT. The CAMRT is the national association for 4 distinct but related disciplines: radiological technology, like X-ray, nuclear medicine, radiation therapy, and magnetic resonance imaging. While other fields like sonography are related to medical imaging, they have their own separate professional bodies and are not part of the CAMRT's core group. For instance, someone performing an MRI and someone administering radiation for cancer treatment are both represented by the CAMRT. An easy way to recall this is to link CAMRT with technologies that primarily use radiation or magnetic fields for diagnosis and treatment. Question 6. An MRT is considering a job offer in a different province and is confused about the different organizations they must join. What is the fundamental difference in the primary function of the CAMRT versus a provincial regulatory body? A. The CAMRT sets salary standards, while provincial bodies handle workplace safety. B. The CAMRT is the National Professional Association, while provincial bodies are responsible for licensing and regulating the profession within that province. C. The CAMRT manages continuing education, while provincial bodies manage the initial certification exam. D. The CAMRT provides legal representation to all members, while provincial bodies only investigate public complaints. Answer: B. The CAMRT is the National Professional Association, while provincial bodies are responsible for licensing and regulating the profession within that province. This question tests your understanding of the division of responsibilities between national and provincial organizations. The CAMRT acts as the National Professional Association, focusing on things like certification, advocacy, and professional development for all of Canada. In contrast, the provincial regulatory body's main job is to protect the public within its specific province by issuing licenses to practice and investigating any complaints. For example, you pass the CAMRT's exam to get certified nationally, but you must then apply to the provincial college in Alberta to get a license to actually work there. Remember it this way: CAMRT gives you the national passport certification, but the province gives you the visa license to work. Question 7. A group of technologists is discussing the CAMRT Code of Ethics and the importance of making sure every patient understands and agrees to a procedure. This discussion is centered on which fundamental patient right that MRTs are ethically bound to uphold. A. The right to a speedy diagnosis. B. The right to choose their technologist. C. The right to informed consent. D. The right to a pain-free procedure. Answer: C. The right to informed consent. The scenario focuses on a core ethical duty related to patient autonomy, with the clue being that the patient understands and agrees to a procedure. The principle of informed consent means that before any medical procedure, the patient must be given enough information to understand what is being done, its risks and its benefits, and then voluntarily agree to it. While a painless procedure is ideal, the ethical obligation is to ensure the patient is a willing and informed participant in their own care. For example, an MRT must explain what a CT scan involves before starting, even if the referring doctor already did. Think of informed consent as getting the patient's full and clear yes before you begin. Question 8. The CAMRT's competency profile outlines the essential skills required for a newly certified MRT. If a technologist fails to perform a procedure safely, resulting in a poor quality image that requires a repeat exposure, which core area of the profile are they failing to demonstrate? A. Professionalism. B. Communication. C. Safe and effective practice. D. Collaborative practice. Answer: C. Safe and effective practice. This question links a practical error to the formal standards set by the CAMRT's competency profile. The area of safe and effective practice specifically covers the technical skills and knowledge needed to perform procedures correctly, minimize risk to the patient, and produce high-quality results. A repeat exposure due to poor technique is a direct failure in this area, as it involves an unnecessary dose of radiation and is not effective. While communication is important, the core failure here is the technical execution of the task itself. Remember, this competency is all about doing the job right and doing it safely every single time. Question 9. As a benefit of membership, the CAMRT provides access to professional liability insurance. What is the primary purpose of this insurance for a practicing MRT? A. To cover the cost of upgrading imaging equipment. B. To provide financial protection against allegations of malpractice or professional negligence. C. To pay for the technologist's annual membership and certification fees. D. To act as a supplementary health and dental plan for the technologist. Answer: B. To provide financial protection against allegations of malpractice or professional negligence. This question tests your understanding of a key CAMRT membership benefit, focusing on the term liability insurance. Professional liability insurance is designed to protect a healthcare professional if a patient claims they were harmed due to an error or negligence in their work. It helps cover legal defense costs and any potential settlements or judgments, which could be financially devastating otherwise. For instance, if a technologist made a mistake that led to a delayed diagnosis and the patient sued, this insurance would be crucial. A good tip is to remember that liability means responsibility for harm, so this insurance protects you from the financial consequences of that responsibility. Question 10. A technologist working in a busy clinic feels pressured to rush through procedures, but the CAMRT Code of Ethics emphasizes taking the necessary time to ensure high-quality care for every individual. This ethical standard falls under which broad principle? A. Patient-centered care. B. Accountability. C. Collaborative practice. D. Excellence in practice. Answer: A. Patient-centered care. This question asks you to connect a specific action, not rushing, to a broader ethical principle from the CAMRT Code of Ethics. Patient-centered care is the principle that puts the patient's needs, values, and safety at the forefront of all decisions and actions. Rushing through a procedure compromises quality and safety, which goes directly against this core idea of prioritizing the individual patient. While excellence is a goal, the specific focus on the individual's experience and safety makes patient-centered care the best fit. Think of it as the treat every patient like they're your only patient rule. Question 11. The CAMRT is not only a certifying body, but also a strong voice for its members. When the CAMRT communicates with government bodies to influence policy on issues like radiation safety or staffing levels, what is this activity called?
A.
Accreditation. B. Regulation. C. Advocacy.
D.
Adjudication. Answer: C. Advocacy. This question defines a key function of a professional association, highlighted by the phrase, voice for its members. Advocacy is the act of supporting a cause or proposal and working to influence decisions within political, economic, and social systems. When the CAMRT speaks to the government or the public on behalf of technologists, it is advocating for the profession's interests and for patient safety. For example, the CAMRT might lobby for better funding for MRI machines to reduce wait times. Just remember, advocacy is about actively speaking up for and supporting the profession. Question 12. A medical radiation technologist has just successfully passed their national exam. Which professional designation are they now entitled to use to signify their certified status in radiological technology?
A.
MD, medical doctor. B. RN, registered nurse. C. RTR, registered technologist radiological. D. PT, physical therapist. Answer: C. RTR, registered technologist radiological. This question tests your knowledge of the official titles or designations that certified MRTs use. The designation RTR is specific to those certified by the CAMRT in the discipline of radiological technology. Each of the 4 disciplines has a similar designation, like RTT for radiation therapy, which signifies that the individual has met the national standard of competence. Using this title is how a technologist publicly shows they are a qualified and certified professional. Think of these letters as a badge of honor that proves you've passed the test and are officially part of the profession. Question 13. The CAMRT plays a crucial role in ensuring the quality of education for future technologists. What is the formal process by which the CAMRT evaluates and officially recognizes medical radiation technology education programs in Canada?
A.
Student registration. B. Program accreditation. C. Curriculum design. D. Faculty recruitment. Answer: B. Program accreditation. This question focuses on how the CAMRT upholds educational standards, with the key term being officially recognizes. Program accreditation is the formal process where an independent body, in this case, the CAMRT in partnership with another organization, assesses an educational program to see if it meets established standards of quality. This ensures that every graduate from an accredited program has received a high-quality education and is prepared for the certification exam. For example, an accreditation team will visit a college to check its labs, curriculum, and instructors. Remember, accreditation is like a seal of approval for the entire educational program. Question 14. An MRT is reading the Journal of Medical Imaging and Radiation Sciences, JMIRS, to learn about new research. Which organization is responsible for publishing this key academic journal for the profession in Canada?
A.
The Canadian Medical Association, CMA. B. The Canadian Association of Radiologists, CAR. C. A provincial regulatory college. D. The Canadian Association of Medical Radiation Technologists, CMRT. Answer: D. The Canadian Association of Medical Radiation Technologists, CMRT. This question asks you to identify the publisher of the main Canadian academic journal for MRTs. The Journal of Medical Imaging and Radiation Sciences, JMIRS, is the official peer-reviewed journal of the CMRT. It is a major resource where Canadian and international researchers share new findings, techniques, and insights relevant to the 4 MRT disciplines. By publishing this journal, the CAMRT helps advance the profession and keep its members informed about the latest developments. Think of the JMIRS as the CAMRT's own professional magazine, filled with the most up-to-date science for MRTs. Question 15. The CAMRT Code of Ethics states that MRTs must be answerable for their decisions and actions. If a technologist makes an error, this principle requires them to report it transparently to their supervisor and take steps to mitigate any harm. which ethical principle is being demonstrated? A. Professional integrity. B. Responsibility and accountability. C. Patient-centered care. D. Collaborative practice. Answer: B. Responsibility and accountability. This scenario describes a situation where an error occurs, and the key concept is being answerable for their decisions. The principle of responsibility and accountability means that a professional accepts ownership of their work, including their mistakes. It involves not just doing the job, but also being transparent and taking corrective action when things go wrong, rather than trying to hide the error. For instance, if an incorrect patient was imaged, accountability requires immediately reporting the incident so the mistake can be rectified. A simple way to remember this is that accountability is about owning your actions, good or bad. Question 16. A newly certified MRT is asked to perform a complex procedure they have never done before, without supervision. To align with the CAMRT standards, what is the technologist's primary professional obligation in this situation? A. To attempt the procedure and learn from any mistakes. B. To refuse to perform the procedure until they have received proper training and are competent to do so. C. To ask a more experienced colleague to do it for them, without informing the manager. D. To search for a video of the procedure online and try to follow it. Answer: B. To refuse to perform the procedure until they have received proper training and are competent to do so. This question tests your understanding of a technologist's professional and ethical duty related to their scope of practice and competence. A core principle of safe practice is to only perform tasks for which you are properly trained and competent. Attempting a procedure without the necessary skills puts the patient at risk and violates the trust placed in the profession. The correct and professional action is to recognize your limitations and seek further training or supervision. This demonstrates a commitment to patient safety above all else. Remember the rule: if you don't know, don't go. Always put patient safety first. Question 17. The CAMRT provides a document that defines the knowledge, skills, and judgment required of a technologist upon entry to the profession. What is this foundational document called? A. The Code of Ethics. B. The Competency Profile. C. The Best Practice Guidelines. D. The Annual Report. Answer: B. The Competency Profile. This question is about identifying the specific CAMRT document that serves as the blueprint for professional practice, with the clue being required of a technologist upon entry. The competency profile is a detailed list of all the abilities an MRT must possess to be considered competent and ready to practice safely after graduation. This document is what the National Certification Exam is based on, ensuring that the test accurately measures what a new technologist needs to know. For example, a competency might be: apply principles of radiation protection to minimize dose to the patient. Think of the competency profile as the official checklist of everything you must be able to do to become a certified MRT. Question 18. During a team meeting, a radiologist and a nurse are discussing a patient's care plan with the MRT. According to the CAMRT Code of Ethics, participating respectfully and contributing professional knowledge in this type of team setting is an example of which principle? A. Professionalism. B. Confidentiality. C. Collaborative practice. D. Accountability. Answer: C. Collaborative practice. This question describes a scenario of teamwork in a healthcare setting and asks which ethical principle it represents. Collaborative practice is the principle that involves working effectively with other healthcare professionals to achieve the best possible outcomes for the patient. It requires good communication, mutual respect, and sharing of expertise to ensure the patient receives seamless, coordinated care. In this example, the MRT is not just performing a task in isolation but is an active member of the healthcare team. Remember, collaboration means working together as a team for the good of the patient. Question 19. The CAMRT Foundation is described as the charitable arm of the CAMRT. Based on this description, what is the most likely purpose of the foundation? A. To negotiate salaries and benefits for CAMRT members. B. To provide funding for research, education, and philanthropic initiatives within the profession. C. To investigate and discipline members who violate the Code of Ethics. D. To develop and administer the National Certification Exam. Answer. B. To provide funding for research, education, and philanthropic initiatives within the profession. This question asks you to infer the role of the CAMRT Foundation based on the term charitable arm. A charitable foundation associated with a professional organization typically exists to advance the profession through activities that are not covered by membership fees. This includes providing grants for research projects, scholarships for students, or awards for professional excellence, all with the goal of improving medical radiation technology. It does not handle discipline or exams, which are core functions of the main association. Think of the foundation as the part of the CAMRT that gives back to the profession by supporting its growth and future. Question 20. The CAMRT's mission includes promoting the highest quality of care for patients. A technologist who carefully positions a patient to get a clear diagnostic image on the first try, thereby avoiding a repeat exposure to radiation, is directly upholding which specific CAMRT ethical principle? A. Safe practice. B. Professional integrity. C. Accountability. D. Patient choice. Answer. A. Safe practice. This question links a specific, careful action to a core ethical principle, focusing on avoiding unnecessary radiation. The principle of safe practice explicitly requires technologists to perform their duties in a way that minimizes risk and ensures the safety of the patient, the public, and themselves. Getting the image right the first time is a perfect example of this, as it directly reduces the patient's radiation dose. While other principles are important, the action described is fundamentally about technical competence for the purpose of safety. Remember, safe practice is all about protecting your patient from harm during the procedure. Question 21. Which of the following is considered a primary benefit of being a member of the CAMRT, as opposed to simply being certified by them? A. The legal right to work in any Canadian hospital. B. A guaranteed annual salary increase. C. Access to resources like best practice guidelines, professional liability insurance, and networking opportunities. D. Exemption from all provincial licensing requirements. Answer. C. Access to resources like best practice guidelines, professional liability insurance, and networking opportunities. This question tests your ability to distinguish between the act of certification and the benefits of ongoing professional membership. While certification allows you to use a professional title, being a member of the CAMRT provides access to a suite of tools and supports designed to help you throughout your career. This includes educational resources, insurance, and connections with colleagues through events and publications. Certification is a credential, whereas membership is an active engagement with the professional community and its resources. Think of it like this. Certification is your driver's license, but membership is like being part of a car club that gives you maps, roadside assistance, and magazines. Question 22. The CAMRT Code of Ethics requires a technologist to act in a manner that is honest and trustworthy at all times. If an MRT notices a mistake on a colleague's paperwork and corrects it without trying to assign blame, instead focusing on patient safety, which principle are they best demonstrating? A. Confidentiality. B. Professional integrity. C. Self-regulation. D. Patient advocacy. Answer. B. Professional integrity. The scenario highlights an action based on honesty and a commitment to high standards, which are key parts of a specific ethical principle. Professional integrity is the quality of being honest and having strong moral principles, which guides a technologist to always do the right thing, even when no one is watching. By correcting an error for the sake of safety and not to cause trouble, the MRT is acting with integrity. This is different from confidentiality, which is about secrets, or accountability, which is about owning one's own mistakes. Think of integrity as your professional moral compass, always pointing you toward doing what is right. Question 23. A provincial health authority proposes a policy change that would reduce the required radiation shielding standards in mobile imaging units to cut costs. The CAMRT leadership is concerned this change could endanger both patients and staff. In response, the association publishes a formal document that outlines its evidence-based opposition to the proposal and officially articulates its recommended standards for the profession and public safety. Which type of official CAMRT document does this action represent? A. A best practice guideline. B. A competency profile. C. A position statement. D. An annual report. Answer: C. A position statement. This question tests your ability to distinguish between different types of official documents published by the CAMRT. The keywords proposes a policy change, opposition, and officially articulates indicate that the CAMRT is declaring its formal opinion on an external issue. A position statement is the correct answer because it is a document used to communicate the association's official stance or recommendation on a significant topic affecting the profession or public health. For example, the CAMRT might release a position statement on the importance of appropriate staffing levels in a radiology department to ensure patient safety. Here's an easy way to remember it. A position statement states the CAMRT's formal position or opinion on a topic, while other documents like guidelines tell you how to perform a task. Question 24. A technologist is working with a patient who is very anxious and asks many questions about the procedure. Taking the time to calmly explain the process, answer their questions, and provide reassurance is a direct application of which element of the CAMRT competency profile? A. Professionalism. B. Research and evidence-based practice. C. Safe and effective practice. D. Communication and collaboration. Answer: D. Communication and collaboration. This question focuses on the soft skills required of a technologist, as outlined in the CAMRT standards. The competency area of communication and collaboration includes all aspects of interacting effectively with patients, families, and other healthcare professionals. Patiently explaining a procedure and providing reassurance are classic examples of therapeutic communication, which is essential for patient-centered care and reducing anxiety. While professional, the specific skill being demonstrated is communication. Think of this competency as how you connect with and talk to people to make their experience better and safer. Question 25. An experienced MRT is interested in contributing their clinical expertise to the profession on a national level. They notice a call for volunteers from the CAMRT for various committees. If they join an item development committee for the national certification exam, what is their primary function? A. To audit the financial records of the CAMRT's educational programs. B. To develop and review exam questions that align with the national competency profile. C. To create new public awareness campaigns about radiation safety. D. To act as a disciplinary body for members who violate the code of ethics. Answer: B. To develop and review exam questions that align with the national competency profile. This question tests your knowledge of how CAMRT members can volunteer to uphold professional standards, specifically in the creation of its certification exam. The keywords item development committee and primary function direct you to the specific task of creating exam content. The CAMRT relies on the expertise of practicing technologists to write and approve exam questions, ensuring the test is fair, relevant, and accurately reflects the skills needed for entry-level practice. For instance, a technologist with expertise in MRI might be asked to create a question about a specific imaging sequence to test a candidate's practical knowledge. Here's an easy way to remember this. Think of these volunteers as the experts on the ground, who ensure the certification exam is directly tied to the real-world work of an MRT. Question 26. When an MRT makes a professional judgment, such as adjusting technical factors for a patient with a specific condition, they are expected to be able to justify their decision based on established principles and knowledge. This aligns with which core CAMRT value? A. Accountability. B. Advocacy. C. Collegiality. D. Philanthropy. Answer: A. Accountability. This question links the act of making a professional decision to a core value, with the key being the ability to justify their decision. Accountability in a professional context means not only being responsible for your actions, but also being able to provide a rational and evidence-based reason for them. When you make a clinical choice, you must be prepared to explain why it was the correct one for that specific situation. This shows that you are a thinking professional who takes ownership of their practice. Remember, accountability is about being able to answer the question, why did you do that? Question 27. The Canadian Association of Medical Radiation Technologists, CMRT, holds an annual general meeting, AGM, each year, which is a key event in the organization's calendar. From a governance perspective, what is the principal function of this meeting for the association and its members? A. To host the largest national conference for continuing professional development credits. B. To announce the winners of the National Certification Exam and award new credentials. C. To negotiate new salary and benefits standards for MRTs across Canada. D. To provide a formal forum for members to receive reports, elect directors, and vote on association business. Answer: D. To provide a formal forum for members to receive reports, elect directors, and vote on association business. This question tests your understanding of the purpose of an annual general meeting, AGM, a standard practice for professional associations. The keywords governance perspective and principal function signal that the answer relates to the formal business and management of the CMRT. The correct answer is to provide a formal forum for members to receive reports, elect directors, and vote on association business, as this is the primary reason such meetings are legally required for organizations. For example, during the AGM, the Board of Directors presents financial statements and annual reports, and members vote on important decisions affecting the association's future. Here's an easy way to remember. Think of the AGM as the official annual business meeting for the organization, not the educational conference it might be held alongside. Question 28. The CMRT Code of Ethics outlines the values that should guide an MRT's behavior. The overarching goal of this code is to ensure that MRTs provide care that is A. Fast, efficient, and profitable for the clinic. B. Legally defensible and minimizes risk to the employer. C. Technologically advanced and uses the newest equipment. D. Safe, effective, and patient-centered. Answer: D. Safe, effective, and patient-centered. This question asks about the ultimate purpose or overarching goal of the CMRT Code of Ethics. The entire code, with all its principles like safety, confidentiality, and integrity, is designed to ensure that the focus of an MRT's work is always on the well-being of the patient. This means providing care that is not only technically correct, effective, and without harm, safe, but also respectful of the patient's needs and values, patient-centered. The other options, like profitability or legal defense, are secondary to this primary ethical commitment to the patient. Remember, the Code of Ethics always puts the patient first. Question 29. A newly certified MRT at a hospital is approached by a colleague regarding concerns about recent changes to their collective bargaining agreement, which affects overtime pay and staffing ratios. The colleague suggests they should contact the CAMRT to file a formal grievance and negotiate better terms with hospital administration. Based on the primary mandate and organizational structure of the Canadian Association of Medical Radiation Technologists, CMRT, what is the most accurate guidance to provide to this colleague? A. The CMRT should be contacted immediately, as its primary role is to represent members in labor disputes and contract negotiations. B. The CMRT can provide legal counsel and directly challenge the hospital's administration on behalf of the technologists. C. The CMRT advocates for the profession on broad policy issues, but does not engage in site-specific collective bargaining or handle individual labor grievances. D. The CMRT is responsible for mediating all workplace conflicts, including those related to pay, as part of its Code of Ethics enforcement. Answer: C. The CMRT advocates for the profession on broad policy issues, but does not engage in site-specific collective bargaining or handle individual labor grievances. This question tests the fundamental difference between a professional association, like the CAMRT, and a labor union, using keywords like collective bargaining and grievance that relate to employment contracts. The correct answer is that the CAMRT advocates for the profession on broad policy issues, but does not engage in site-specific collective bargaining or handle individual labor grievances. While the CAMRT champions the profession by setting standards and influencing national health policy, it is not structured to negotiate employment contracts or pay for its members at a specific hospital. For example, the CAMRT might lobby the government for safe staffing guidelines across Canada, but a local union is the body that negotiates your specific hospital's pay scale. A simple way to remember is that the CAMRT looks after the profession as a whole, while a union looks after the specific job conditions of its members. Question 30. A key role of the CAMRT is to protect the professional titles associated with its 4 disciplines, such as RTT, Registered Technologist, Radiation Therapy. What is the main reason for protecting these titles? A. To ensure only CAMRT members can use these titles, creating exclusivity. B. To help the public identify qualified and certified practitioners, which enhances patient safety. C. To make it easier for employers to set salary scales based on credentials. D. To prevent technologists from other countries from using similar titles. Answer: B. To help the public identify qualified and certified practitioners, which enhances patient safety. This question asks about the purpose behind protecting professional titles, and the core reason is public safety. By restricting the use of titles like R.T.R. to only those who have passed the national certification exam, the CAMRT ensures that anyone using that title has met a national standard of competence. This helps patients, employers, and other healthcare professionals easily identify who is a qualified professional they can trust. It's not about exclusivity for its own sake. It's a critical tool for public protection. A good tip is to remember that a protected title is a promise of quality and safety to the public. Question 31. An MRT is participating in a research study at their hospital. The CAMRT Code of Ethics and Best Practice Guidelines would require the technologist to ensure that all patient involvement in the research is A. Compensated financially, B. Voluntary and based on informed consent, C. Guaranteed to result in a medical benefit for the patient, D. Kept secret from the patient's family doctor. Answer: B. Voluntary and based on informed consent. This question applies ethical principles to the specific context of clinical research. A fundamental rule in any research involving human subjects is that participation must be completely voluntary and that the participant must give informed consent. This means they understand the study's purpose, risks, and benefits, and agree to participate without any pressure or coercion. This upholds the principle of patient autonomy and is a cornerstone of ethical research practice supported by the CAMRT. Remember, in research, the patient's right to choose freely is the most important rule. Question 32. The CAMRT defines scope of practice for the profession. What does scope of practice primarily refer to? A. The physical area within a hospital where an MRT is allowed to work. B. The range of procedures, actions, and processes that a certified MRT is permitted to undertake. C. The list of CAMRT members in good standing within a specific province. D. The number of patients an MRT is expected to see during a single shift. Answer: B. The range of procedures, actions, and processes that a certified MRT is permitted to undertake. This question asks for the definition of a key professional term, scope of practice. This term refers to the legal and professional boundaries of a profession, defining what a qualified practitioner is educated, competent, and authorized to do. It is not about a physical location or workload, but about the specific services they are allowed to provide to patients. For example, performing an X-ray is within an R.T.R.'s scope of practice, but prescribing medication is not. Think of scope of practice as the official job description for the entire profession. Question 33. According to the CAMRT's guiding documents, What is the relationship between a technologist's professional responsibility and their personal values or beliefs? A. Personal beliefs should always take priority over professional responsibilities. B. Professional responsibilities must be carried out objectively and must take precedence over personal beliefs in the context of patient care. C. An MRT should only treat patients who share their personal values. D. Professional responsibilities and personal beliefs are considered irrelevant in a clinical setting. Answer. B. Professional responsibilities must be carried out objectively and must take precedence over personal beliefs in the context of patient care. This question addresses the complex interaction between personal views and professional duties, a key concept in medical ethics. The CAMRT's ethical standards require MRTs to provide care to all patients without discrimination, meaning their professional obligation to the patient comes first. While an MRT has personal beliefs, they cannot let those beliefs interfere with providing safe, competent, and compassionate care to every patient. This ensures that every patient receives the same high standard of care, regardless of their background or the technologist's personal views. The simple rule is, in the clinic, your professional duty to the patient always comes first. Question 34. The CAMRT structure includes a board of directors. What is the primary role of the board of directors in the organization? A. To mark the national certification exams. B. To provide clinical instruction to students in educational programs. C. To handle day-to-day administrative tasks like processing membership renewals. D. To provide strategic governance, set policy, and oversee the management of the association. Answer. D. To provide strategic governance, set policy, and oversee the management of the association. This question tests your basic understanding of how an organization like the CAMRT is structured and led. The board of directors is the governing body responsible for the big-picture leadership of the association. They don't handle daily tasks, but instead set the overall direction, create policies, and ensure the organization is fulfilling its mission and is financially healthy. For example, the board would approve the strategic plan for the next 5 years or create a new policy on continuing education. Think of the board of directors as the brain of the CAMRT, making the major decisions about its future. Question 35. The concept of professionalism is a major theme in CAMRT's guiding documents. Which of the following actions is the best example of a technologist demonstrating professionalism in the workplace? A. Arriving to work on time and treating all colleagues and patients with respect. B. Discussing confidential patient information with a colleague in a public cafeteria. C. Wearing the most fashionable and expensive scrubs available. D. Complaining about hospital management to patients. Answer. A. Arriving to work on time and treating all colleagues and patients with respect. This question asks you to identify the best practical example of professionalism from a list of behaviors. Professionalism is a broad concept that includes reliability, respect, integrity, and a commitment to excellence. Being punctual and treating everyone with courtesy are fundamental aspects of professional conduct that build trust and contribute to a safe and effective work environment. The other options describe unprofessional behavior, such as breaching confidentiality or complaining inappropriately. Remember, professionalism is about how you conduct yourself and represent your profession every minute of the day.